Welcome to the Gestalt Get-Together, presented by SpeechTherapyPD.com. The Gestalt Get-Together is your podcast for discussing the state of the evidence of Gestalt language processing, associated therapy modalities, and how our field is responding to the frameworks of GLP and NLA. I'm Corinne Zmoos, MS, CCC-SLP, a musical language therapist who's dedicated to celebrating while investigating Gestalt language processing, protecting the scientific method, and reducing cognitive linguistic biases about this framework and these clients that I love so much. My areas of focus are psychoacoustics, music theory, and musical syntax in GLPs. Previously, I worked closely with key players in the GLP quote-unquote movement, but experienced concerns with the propensity for logical fallacies and resistance to quantitative inquiry in the larger community. I now identify myself as lovingly skeptical, and I hope that listeners will sharpen their ability to recognize linguistic choices that move a cause forward without strong evidence, what level of evidence we're actually dealing with, and where we need to go next to support these kids that we care about. So what can you expect from us? Our episodes will provide balanced and educational interviews about clinician experiences, live coaching and problem solving about therapeutic decision making with a healthy dose of musical language recommendations thrown in, discussions on the logical fallacies and cognitive biases that emerge when implementing a new approach, and even some elements of the BITE model that have emerged within the larger GLP movement. Most importantly, this podcast is intended to help you embrace, investigate, and analyze your unique role in child development for Gestalt language processors without getting in your own way. This podcast is a celebration of neurodivergent learning, and we look forward to you learning with us along the way. Welcome to a recording of the Gestalt Get-Together. This is your podcast for discussing the state of the evidence of Gestalt language processing, associated therapy modalities, and how our field is responding to the world of GLP. This podcast recording is 1 hour, 30 minutes, and is offered for 0.15 ASHA CEUs. My name is Corinne Zmoos, MS CCC-SLP, and my aim in this podcast is to investigate psychoacoustics, music theory, as well as musical syntax and Gestalt language processing, because those are some of my areas of focus. Now, I want to make it clear that I love GLPs. I'm fascinated by the ideas behind Gestalt language processing. I work with these kids every day, and I've had really great success working with families through the frameworks around this. But I also want to be lovingly skeptical, and I hope that listeners, you'll be able to sharpen your ability to recognize some of the limitations when it comes to Gestalt processing and the ways that we're supporting these kids. This podcast aims to provide balanced and educational interviews about clinical experiences, live coaching and problem solving about therapeutic decision making, and then webinars like this, when we can talk about things like biases, logical fallacies, so that we know that we are approaching decision making with the right things in mind. And so what I'd love to do now is share a visual as we start to talk about cognitive biases. So this is a primer, an introduction to what some cognitive biases are when it comes to clinical decision making, particularly when we're consuming information on social media. Now, Gestalt language processing and ideas around it really, started to explode when it came to the age of social media. But when we think about media and the biases that can go into that, especially when anyone can share information about this with just a couple clicks of a button, we do want to be more careful and try and fine-tune the way that we consume this information. Now, I am far from perfect when it comes to this. The more I learn about cognitive biases and try to apply them to the world of Gestalt language processing, the more I realize how they permeate my thoughts and my decision making. And so that's one of the reasons that I'm so passionate about teaching about this, is because it's something I struggle with every single day. Now, the goal of this webinar and this podcast is to explain the basics of cognitive biases and how they seem to permeate the consumption of Gestalt language processing claims and discourse. There's so much valuable information, insights, and recommendations out there that have truly changed the way that I practice with the kids on my caseload. But also, I think it's important to come away with a foundational understanding of these biases, figure out where and why these may emerge as related to the dissemination of ideas around GLP, and hopefully start to recognize them in yourself. So by the end of this recording, I would love for you to come away with these three outcomes. I'd love for you to be able to define what a cognitive bias is, and then how this concept pertains to our field. Everyone does it. It is so common and very normal. Secondly, I would love for you to be able to describe at least three common cognitive biases. We're going to go over four in detail today, but it might shock you, there are actually over 188 documented cognitive biases. Don't worry. You don't have to know all of them. I'm sure in a future episode we'll talk about more, but I want to give you four salient ones. I'd also love for you to come away being able to share an example of each one that relates to information consumption about Gestalt language processing on social media. And thirdly, I'd love to share a framework I use to be able to create a plan, to be able to shift your consumption about this GLP information on social media and try to start determining, are you engaging in any cognitive biases, or are you noticing the person who's disseminating the information engaging in one of those as well? So let's define it. What is a cognitive bias? Cognitive biases are unconscious. They are unconscious systematic thinking and decision-making errors, and they occur in response to information that we take in. This can be clinical information, it can be research-based information. When we think about consumption of media, perhaps about politics or about even local news, our brains are engaging in cognitive biases. We all have different lived experiences through which we perceive the world around us. And so we inherently have bias when we're trying to make sense of information and integrate it into our understanding of the world. Now, as we process and interpret information from our environment, especially when we're thinking about our clinical lens and applying information to our clients and their families, our inner worlds impact how we make judgments about that information and what to do next with it. Now, these biases can distort our perception of information, and this can result in inaccurate interpretations, skewed interpretations, and these can have positive outcomes. These biases and our interpretations can have negative outcomes, and they can have neutral outcomes. And it really depends on the context that we're applying our decision making to based on our perception of that information. Now, these patterns of perception that each of us have, they can unfortunately reduce rational decision making for our clinical work. And we're going to talk about some of the reasons underneath why we engage in cognitive biases. Now, they're often a result of our brain's attempts to simplify things. We love simple, we love clear answers. And so our brains are attempting to simplify and reduce the amount of cognitive resources that we need for information processing. I mean, without social media and our phones, we're taking in so much information. But then you add on the fast-paced information overload that we're all getting when we think about our phones or even TV, access to the internet. It's so much information, and we're really looking for ways to simplify that. And let's get to the good stuff. Let's get to the answers so that we can help these clients as soon as we can. But in the pursuit of saving time, saving cognitive resources, and also considering that we are human beings, we are trying to avoid fight or flight situations. We want to feel safe, we want to protect our beliefs, and we want to protect our emotional state. And sometimes certain information can put our emotional state and our feeling of safety, it's hanging in the balance a little bit. Now, everyone experiences cognitive bias because we're human. You're going to hear me engage in it and giving this presentation. You might engage in it when you are interpreting the information I'm sharing tonight. It is so common and normal. So I don't want you to come away from this feeling like, oh my gosh, I'm not doing a good job of processing information. Oh my gosh, I need to change everything. The first step is to learn about it and start to notice it in yourself. There's a statistic I read today as I was just catching up on any new research of this, and I'd have to find the paper I read it in, but someone was sharing findings that by engaging in training around cognitive biases, participants were able to reduce them by 29%. So by building your awareness and starting to think about it, you can start to reduce the way that you're using them. Now, it can be much easier to spot these in other people, so that's where I recommend starting. Our thought processes are so automatic in ourselves, but if you look at the communication patterns of others, as well as their decision making, you might start to notice this. Once we start to notice these patterns in other clinicians or researchers, people in academia who are sharing information about Gestalt processing, it can be easier to normalize them. It's so normal, it's everywhere. And also start to have compassion for your own. Now, the more I describe what I notice in others' choices and communication about GLP, the better able I am to then identify them in my conversations, my writing, and the application of my ideas in sessions. Okay, so before we get in too deep, I just want to give a couple of common cognitive biases to get you thinking about this. So one would be, I only pay attention to articles and papers and stories that confirm my opinions about what a Gestalt language processor is. Or I only pay attention to articles, papers, and stories that affirm that Gestalt language processing is not a real thing. Another one is I blame outside factors when things don't go my way clinically. It's not that my techniques to help a Gestalt language processor weren't working. Maybe it's that "Oh, this kid's ABA therapist must be drilling I want phrases." Perhaps a cognitive bias that I'm engaging in is that I'm assuming everyone else shares my opinions or beliefs, or that once I explain GLP to you, you're going to see it too. Once I explain it the right way, you're totally going to see it the way that I see it. Here's one I see often, and one that I might be guilty of myself. I learn a little bit about a topic like GLP, and then I assume I know all there is to know about it. For example, taking a single PDH course about GLP and starting to disseminate information without having firm foundational knowledge of different theories of language acquisition or even the neuroscience of language acquisition. If we're talking about language processing, do we have a firm understanding that there are many theories of language processing? And truly, no one has landed on the final answer. So here are 5 big reasons that cognitive biases emerge in our work. And I want to see if you can think about if any of these have come up for you. And please feel free to share about it in the chat. I want to hear about your experiences if any of this feels salient. Number 1, emotion. Bias comes up when we are starting to feel defensive, if we're feeling really excited about something. If you finally have this framework that explains kids you've been working with, okay, these kids who engage in echolalia and they act out scenes from movies and they love to line things up the same way every time, this idea of gestalt, it really captures them. You might feel really excited. And so you might engage in or respond to people who are engaging a cognitive bias because of that emotional state. I am so, so, so excited about this information and the way that we're grouping together these characteristics. It makes me feel more confident in my ability to be a clinician. But there also might be bias that comes up for the negative emotions. That when I encounter information, claims, or arguments that GLP is not a real thing. It's pseudoscience. Anyone trying to ask questions to go a bit deeper, perhaps defensiveness comes up. I see a lot of anger come up in comment sections. I see a lot of sadness come up for clinicians when they learn about this whole framework. They try and share information about it, and then others are not interested in it, or they find it to be false or very faulty. Some sadness can come up for those clinicians. And so we're seeing a lot of emotion when it comes to, and you might not be engaging in these social media communities, but I know in particular on Instagram and then on Facebook groups, a lot of emotion can get heightened. And emotion is really powerful, but also it can, like we said before, really distort our decision making about the way that information is going to be processed and then applied to our decision making. Another really interesting one is social pressure. So, social pressure can impact our ability to make decisions when it comes to information about Gestalt language processing or really any clinical ideas. If you see this idea of kind of the bandwagon effect, where you see a lot of people are jumping onto ideas about echolalia, about only using child-led therapy, about certain ways to program AAC devices that are GLP affirming. There might be that feeling of social pressure where I have to do this too. Everybody else is doing this and it seems really, really important to them. And so I need to do all of this as well in the exact way that it's laid out. And I also see in comment sections that when there's some sort of deviation from the agreed upon way of approaching GLPs, there can be pressure and backlash to that. There are also individual motivations when it comes to engaging in cognitive bias. And so when we see that there are certain incentives to it, perhaps prestige, the reinforcement that comes from attention, if you get a lot of likes, comments, and follows for sharing certain types of information that might be biased, there can be individual motivation there that is so reinforcing. People are looking to me for my opinions and ideas. I feel valued. And when we think about in the field of speech language pathology, where school SLPs have uncapped caseloads, medical SLPs are exhausted and they witness so much pain and suffering. Early intervention SLPs are traveling all over, they're exhausted. And it can be a pretty thankless profession sometimes. If you're showing up on social media and you're presenting information, your ideas and your arguments, and you're getting a lot of feedback for that, wow, that can feel really, really good. And so there's that individual reinforcement and motivation to keep putting out ideas that may be deeply biased. And what I've noticed on social media is that sometimes the most biased ideas and arguments are the ones that get reinforced the most for some of the reasons we are going to keep talking about. When we get down to the why of why these biases, permeate our communication as human beings. There may also be financial motivation that if you're sharing certain ideas, especially communicating ideas as facts without having really strong evidence behind them, there can be financial incentives there. You might be motivated to continue putting out certain messaging that you may not even realize is biased. I think that most people who are providing information about GLP are really doing it in good faith. They want to support their clients. They want more families to know about this. They want more clinicians to be able to recognize this collection of traits and provide supports and intervention that really work. And also, if by putting out those ideas in certain ways, there is that financial reinforcement, and of course, we're going to want to keep doing it. Another one is the idea of heuristics, mental shortcuts. We are exhausted as a profession. We're overworked. We have very little time when it comes to documentation, when it comes to, I know a lot of people have, especially an outpatient, have moved to 25-minute sessions rather than 50 to 55-minute sessions. There's not a lot of time to do that deep thinking. And by the end of the day, you're just ready to go home, be with your kids, sit on the couch, put on a movie. And so humans love heuristics because it can shorten the amount of time it goes from stimulus to response. If information comes in, we can engage in these mental shortcuts to make sense of new information. However, that can lead us to making snap decisions or snap integrations. We say, there's the information. I'm going to quickly integrate this into what I know about the world or what I feel about the world, and then proceed from there. But very likely, we're leaving out a lot of the nuance in there. And we also might be engaging in black and white thinking, which is another element that I've noticed in the social media environments where GLP is widely discussed, is that there is a lot of black and white thinking, either or. And that can leave out a lot of the qualities, at least in the kids that I work with, that aren't that simple. And then the fifth one that comes up a lot when it comes to the reasons that we have cognitive biases are attention limits, especially in the technology and internet age. Our attention spans are, at least I can speak for myself, very, very short. Our attention spans are quite short. And This could also be, the fact that we're very busy and have very little time for the deep thinking, lots of research that could go into finding all the information we need to weed out that bias. We're going to talk about one cognitive bias that is primarily focused on attention, and I hope that that will help us expand on this fifth one a little bit more. Now, I'm so curious for anyone who's watching and listening, if any of these 5 reasons stand out to you, or if you can identify how any of these might have impacted your decision making with a client in the past or in your own life. While you're thinking about that, we are going to start to think about, like I mentioned, the attentional bias. So, what is the attentional bias? Attentional bias means that we are drawn to stimuli that are best able to capture and hold our attention against other environmental stimuli. I want to look at something and I'm going to pay attention to something that's going to hold my attention. Now, it's interesting when we want to think about some of the reasons for this psychologically. I like to think about things from an evolutionary perspective as well. Like, why did my ancestors need this? How did it help them survive? So, attentional bias, we tend to pay attention to things that help us avoid a threat response. And that threat response, think about, we're trying to get through the day. We're trying to have the most fun we can. We're trying to be the most regulated we can. Nobody wants to be in a threat response for most of their life. And so if we can pay attention to things that help us avoid threats, help us avoid negative emotions, help us avoid conflict, our brains are going to want to pay attention to those. Now, for some people, what's interesting is that they have increased attention to negative stimuli. And there have been findings that people with heightened anxiety traits or depressive traits do tend to spend more attention on negative stimuli because by ruminating them or paying more attention to them, they feel a greater sense of control that they can survive. If I pay so much attention to the thing that is threatening me, then I can survive through it. Now, other people, they pay more attention to positive stimuli because if I'm paying attention to something positive, then my brain is staying in a place of reinforcement and reward, and that helps me avoid negative feelings, which may feel like a threat response. So when we're thinking about evolution, attentional bias may be related to the fact that we are hardwired to survive. We are hardwired to notice elements of our environment that could be a threat and which ones could be rewarding to us. No matter how safe and comfortable our lives are, we're not being chased by giant animals, at least I'm not. Our brains haven't really caught up to that reality of how safe some of our lives truly are and how lucky we are to be that safe. The older parts of our brain are still trying to protect us from so much, and it kind of alchemizes smaller threats into the bigger threats that our ancestors used to have to deal with. Now, I want to think about how that survival threat might show up when it comes to our jobs. If our financial and professional success is resting upon certain therapy techniques being true, we're probably more likely to pay attention to information that's going to make our career stay successful. Attention might be over allocated to information because it creates positive emotions. I'm paying lots of attention to certain types of social media claims and arguments that make me feel really good about myself. There are claims and arguments and tweets and comments where I see myself in them. Okay, that person just said what I was thinking. I feel reinforced. What I'm doing is helping because I see other people reinforcing that. Perhaps I'm paying more attention, my attentional biases to things that alleviate stress and alleviate negative emotions. If I see someone defending a certain thing that I believe to be true, I can release some of that stress that, am I doing the right thing? So much goes into our decision making for each client in front of us, and it can be quite a relief to see someone reflect back that our idea is perhaps the best idea when they've never met our client and never will. We might also engage in an intentional bias for something that aligns with our expectations. Human beings really love to be able to predict things. And so if something we predicted happens, it aligns with our expectations, we're going to pay a lot more attention to that. It's rewarding and reinforcing. And if we're seeing things posted perhaps on a Facebook group that align with our expectations about what a child might do next in their language acquisition process, we're going to pay more attention to that. And like I mentioned before, the idea of cognitive resources and competition of cognitive resources, our attentional bias, if we're already paying attention to something and we're paying attention to something that is capturing us, it tends to require less cognitive resources. We don't have to engage in deeper thinking and critical thinking because our attention is already on something that feels good, rewarding, and reinforcing. So let's talk about two examples that you might encounter of attentional bias in the field. But I'd also love for you to start to think about where you've seen attentional bias in your own practice or in your own life outside of your work. Okay, so here's an example. And I'm using first person to kind of put myself in the position of someone who might be engaging in this bias. But a lot of these examples are drawn from my own experiences, particularly when I was all in GLP, NLA, let's go, no compromise. It was, I almost made it my identity. And that's also why I'm pretty passionate about talking about this, is because by recognizing bias and then logical fallacies, I was able to create enough distance. I'm still working on it, where I could start to really think deeply about what is working for the kids in front of me and what isn't. So, examples in the field. One, I primarily work with GLPs at my clinic, and so my professional reputation and financial success hinge on these ideas being true. I over allocate my attention to developing my GLP skill set and then seeing those GLP qualities in the kids in front of me. My attention is so focused on capturing and holding information about what is Gestalt language processing and how can I get better at it, that I'm not paying a lot of attention to parts of it that might not be working or other ideas and skill sets that might also help that child in front of me. I might also be allocating so much attention to recognizing the patterns that are associated with Gestalt language processing that I'm missing other patterns that might help explain what that child is experiencing in their brain and body. Another example. So I work with a GLP from 3 to 4 p.m., and I'm using a lot of ideas from NLA or natural language acquisition. But my 4 to 5 p.m. client, who's not a GLP, they're also working on expressive language. Now, since I was already engaging in deep attention to NLA ideas to work with that GLP, I just implicitly, without realizing it, I carry these techniques over to save those cognitive resources, whether or not that's actually going to be helpful to that next client who's in front of me, who's not a GLP. Now, here are two examples from social media. Okay, so if I spend a lot of time in a Facebook group where the majority of posts are looking for help when it comes to the application of NLA, my attentional bias may assume that the answers to those questions are true because I'm not witnessing any different perspectives on those questions. I'm not necessarily, if they're asking for specific help with that one approach, I'm not seeing recommendations or ideas to bring in another approach. But because my attention is so focused in on stimulus response of someone asked a question, they're getting these answers, I may be engaging in, you know, not the strongest decision making because I'm not necessarily integrating information from other places. My attention just isn't there. Now, another thing is that social media posts about NLA and GLP are usually really cute. They're usually really pretty. They naturally hold my attention longer. If something's beautiful, we want to pay attention to it. They hold my attention longer and I want to share them to my followers. I want my Instagram stories to be really pretty and visually engaging. Now, when my followers like and comment on these really lovely, well-crafted, well-designed stories, I then get reinforced for sharing them. And when people are liking and commenting on my things, I feel connected to them. And this connection feels like a supportive, safe community. And then if we go back to evolution, if I feel like I'm in a safe, supported community, I may not feel as threatened. My threat response might go down. So that's attentional bias. And I'd love for you to think about if you've seen any of this or if you recognize any of this in your own engagement in the social media environment, in conversations with others, or outside in your personal life. The next one you may be more familiar with. This one is called confirmation bias. So here's the what. Confirmation bias is the human mind's tendency to analyze, search for, and integrate information in ways that confirm its current beliefs. We feel really good when our current beliefs about the world, our job, and our clients are confirmed to us. What a relief. My ideas are okay. I'm thinking about things correctly. It's a big relief. But confirmation bias also includes this element of discrediting or explaining away information that does not support those existing beliefs. Now, the why of it. We prefer evidence that supports our existing beliefs because it feels integrated. It's aligned with our current behavior. And I don't know about you, but changing my behavior is a lot of work. It's really hard. And so getting information and even considering having to update our schema about that part of our career or our life can feel like a threat response. We tend to ignore or downplay any arguments or evidence that questions our beliefs. Interrogating our beliefs about our work, about our careers we've worked so hard for, this takes effort, it takes time, and it takes a lot of vulnerability. This is something I struggle with every day, is trying to notice and fight against my own confirmation bias. Now, if we're interrogating our own bias, if we're interrogating that certain information may, make us realize that we are wrong about something, it can create really distressing emotions. I know for me, when I think back to a lot of the autistic kids I worked with before I learned about the concepts of GLP, I want to kick myself because they were communicating to me through echolalia, and I didn't know what to do with it. When I started to learn about these ideas that echolalia could be tied to really rich context that had an underlying meaning that wasn't tied to, very clear semantics or syntax, I didn't know it at the time. And so I had to update the information I had about the way the creativity of that communication pattern. And I still feel really guilty. It created distressing emotions that still haven't truly subsided, no matter how much I tell myself that that was the way that we were practicing at that time. It still really hurts to know that I wasn't able to do that at that time. Now, here's some examples in the field of where confirmation bias may arise when it comes to ideas around Gestalt language processing. So, I evaluate a child whose parents come to me and they're looking for NLA. And this happens often in my practice because I work exclusively with GLPs. They reported to me that their child, in their perception, is a stage 1 GLP. Now, I am so eager to help them with this framework that I might have just learned about. I feel so excited about it. And to me, this family is coming in and they're confirming to me my existing beliefs that Gestalt processing is something that people know about, they want to work on, that it's real, and that my services to help them, they're important to them. Confirm, confirm, confirm. Now, I might be so eager to help them through this framework that I don't thoroughly assess certain things. And maybe I even forget or place no serious questions or investigation about the fact that I should probably refer out for hearing loss or low vision concerns. I may have glazed over some of the red flags related to those two areas because I was engaging in confirmation bias that this is what I need to work on. Your child is a GLP. And because it was confirming this information and this framework that I really believe in, I wasn't integrating or noticing all the information I needed to be able to see the totality of this child in front of me. And that may bite me in the butt later on if they're not responding to techniques because they can't hear me. Another one we might see out in the field is I read research papers that support these techniques. I read articles, I read opinion pieces, I read anecdotes that are supportive. It's working for those kids too. It's working for my kids. Confirmed. I'm going to keep doing what I'm doing the way I've been doing it. But I tend to avoid or feel uncomfortable when I encounter research papers that question my approach, or they question the underlying theories of it, or even, people who write that there's just not enough information to say that this is the truth or this is the way. I get that feeling in my stomach of, oh no, because it all comes back to threat response. It really does. We want to feel safe. We want to be right because we want to help people. We really want to help people. What I notice is that when I'm engaging with writing or opinions that question the beliefs about Gestalt language processing, still now, I get that feeling in my stomach. But I've been really working hard to let that feeling exist. It's my body trying to protect me from something, and then hooking myself onto that greater good of really thinking more deeply about these things that I believe or these things that I want to implement. If I can hold the two sides of it well, then I know that that's going to be helpful for my current clients and future clients. People sharing different ideas, different research and opinions, it's really important for me because then I get to look inward and look back on what I've learned and what I believe and see if there's anything that needs updating. I can see the gaps in my own thinking because I'm not thinking the same way they are. I might be able to gain something or learn something from that. Or I may come away from it and say, no, thank you to all that. But if I don't actually engage with that information or that writing, I'm never going to get there. Now, here's some examples on social media. Someone might say, I only like and share Instagram posts, or they may not say it, but they engage in this pattern of behavior. I only like and share Instagram posts that provide information related to positive effects of GLP focused techniques, the success stories. We all want success stories. These posts are aligned with my current practice and make me feel like I'm doing the right thing. These success stories are so motivating. It's so exciting to see that other kids are going from quoting a movie in its totality to this rich generative language where they're constructing complex syntax. That path, that language acquisition process is so inspiring because then I think that my clients can do that too. And it also confirms to me that the clients who have gone through that under my care, okay, yes, this is happening in other places to other people. Now, something that I see often or I hear about often is individuals on social media who unfollow each other, they avoid each other's content, or they even block each other if someone questions the theoretical foundations of Gestalt language processing. They might block or engage in arguments in the comments, and not like sound arguments, but emotional based arguments when someone expresses concerns that research is lacking. There's a lot of great anecdotal evidence out there, and that's what I share a lot because I haven't been able to engage in really rigorous research yet. And so I share anecdotes and patterns of anecdotes, and that's what most of us have at this point. But when we want to talk about concerns about that, there can be a lot of pushback to it, that anecdotes are the most powerful. But as we'll talk about through the survivorship bias, that may fall apart a little bit. I love a good anecdote. I really do. And also, when it comes to survivorship, we might be missing out on some really important information. Now, for someone on social media who is wanting to engage in confirmation bias, they may feel like people who don't fully agree with them, who are presenting information that does not confirm, they feel like those people, they just don't get it. They're stuck in their old ways. I've even seen the word hater come up, which kind of cracks me up when it comes to like two clinicians talking about each other. They're just being haters. Okay, so that's confirmation bias. And if anything comes up for you, you feel like you've experienced this yourself, or you've seen this happen on social media or in clinical conversations, definitely share about it in the chat. I'd love to hear about it. Okay, so here's survivorship bias. This was one that really helped me start to shift my perspective when it came to kind of untangling my almost limitless belief in GLP and NLA, like go, 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 all of it. So like head first all the way in, was the idea of survivorship bias. And this was actually something I started to consider when I started to talk to more parents um, who would reach out because my specialty is thinking about music and the science of music with autistic kids when it comes to language. So I'd have people reach out and ask about music. But what it led to was a lot of conversations with people who they were trying all the techniques that were supposed to work, right? I've only read stories and anecdotes about it working, and it wasn't working for their kid. And they felt so dejected, so confused, and they didn't know what to do. They're like, I guess I'm gonna keep trying, because it seems to work for other kids. I'm just gonna keep trying. And it really started to make me think about, and once again, those are just anecdotes, but it really made me think about this idea of survivorship bias. And I hadn't heard about this bias until I started hearing about the idea. I saw the phrase used when it came to um, there's jokes where people are like, why does everybody have autism these days? And it's kind of this idea of like survivorship bias of like back in my day, we didn't have all this autism. And perhaps that's because autistic individuals in the past were not present in the community as much. Perhaps they were institutionalized. And so this idea, and it's not just about survivorship like life or death. Survivorship bias is the tendency to concentrate on certain people or certain entities that passed a certain selection process. And then we overlook or discount those that did not. And so for perhaps, and I hear this from a lot of older individuals of like, well, back in my day, we didn't have all this autism, is because just in the public view, or perhaps in their own life experiences, they only had a certain amount of individuals to concentrate on that didn't include autistic individuals who were perhaps at home, kept out of the public eye, or institutionalized, or at schools or clinics where they were not visible, or engaging in the greater community. And so it didn't seem like there was as much autism, but that's because people were engaging in a certain type of selection process where only certain data points were visible and others weren't. So the selection process in this case that really stood out to me is that children who are receiving interventions that might be aligned with NLA or other GLP affiliated techniques, and they show successful responses to it, those are the ones that are visible to most people. But who's missing from the conversation that doesn't pass that selection criteria? So, why does survivorship bias come up? When we want to think about survivorship bias, it's because it plays into what we can perceive. We rely on our senses to make sense of what is going on around us. And so, if we're only witnessing what is there, it's harder to come up and be creative about what isn't there. We're really so much more reliant on what is present in front of us to make decisions rather than taking the effort and the time and the vulnerability to think about what might be missing. And so, when it comes to survivorship, who's passing through that selection process? Those are often the ones that help us with confirmation bias, that make us feel really good. Everybody loves a feel good story. I don't know of any Instagram accounts out there that are only posting and talking about the kids for whom this isn't working. Here's another story about a child who didn't make a lot of progress. And also, if there's financial or reputation elements at stake, it's hard to fill your clinic if you're only talking about clients or marketing for clients that didn't make a lot of progress. And then there's also reputation, where if you're only talking about and presenting about and sharing information about the kids for whom this didn't lead to great progress, that's not going to support your reputation feeling, like the strength of a reputation. And so that's where survivorship can really start to bloom. Now, some examples in the field, someone might say, I'm the SLP on an early intervention team, and I'm going to lead an in-service about GLP because I think it's going to help my team so much. Now, to prove my arguments, I really want people to think this is true. Without realizing it, or maybe I do, I'm going to pick 3 clients who I've been working with that are thriving. I've been using these techniques and they're making so much progress. It's totally working. They've got all those qualities of GLPs. I'm using the modeling, I'm using intonation, I'm singing, I'm mitigating, and it's happening. But I consciously or unconsciously might be avoiding talking about 2 of my clients. I'm doing all the same stuff, but they're not making the same kind of progress. Um, and so the techniques don't seem to be working for them, but I really need my team to buy in. And so I'm going to use that survivorship bias because I'm going to pay a lot of attention to those who pass through the selection process and not as much attention to the kids who do not. And this can be, we might not even realize that we're doing it. Also, because we're really excited about, and that's the emotional part of it. I'm really, really excited about certain kids making great progress. And I'm really, really excited about sharing this information with my team because I want more kids in my state or my county to make this progress. But what about those kids for whom it's not working? Are we thinking a lot about those kids and coming up with better ideas for them? Another field example of survivorship bias might be I read and I cite anecdotes and articles, I'm sharing stories or I'm sharing reels, or I'm sharing TikToks about these success stories of GLPs. But I'm having a hard time finding information about clients and families for whom this approach did not work. Even if I really want to, I won't. Maybe I'm really curious as a clinician about can I talk to families where their kid has all these qualities that are related to this idea of Gestalt language processing, but the approaches aren't working. I want to talk to them. What's going on there? But it might be hard to find those people. And we think about when it comes to social media side of it, why that might be true. We talked about like reputation as well as like marketing and financial, as well as our own emotional stake in wanting to share the good stuff. But on the other side of it, when it comes to families, there might be some shame involved. So here's an example. Someone might say that in a Facebook group dedicated to NLA and GLP discussions, I tend to notice that parent stories of success and lots of gratitude for this approach are everywhere, which is awesome. It's so exciting to see that. Now, as a clinician, I see all these success stories, but so I continue to use all the recommendations. If all of this is working for them, I should keep doing it. But then I want to slow down and consider who is not posting. How many parents or clinicians in that group are reading all of this? And they're looking at their kid who seems like a GLP, but the intervention ideas aren't working. And so they might not post as much because there might be shame involved. There might be guilt involved of I'm not doing enough. I'm not doing it right. It might be scary to ask for help. For some people, and also culturally, asking for help is not typical for them. It doesn't feel safe to do so. And they also might internalize something not working as being their fault because they're not rising to the occasion. Whereas it might be that those techniques are not individualized enough for that child or aren't a good fit for the way that they process the world. Now, another example, social media might be that I witnessed an Instagram comment from a parent who genuinely expressed curiosity in good faith. They asked underneath a post, whether there are GLPs for whom this approach does not work. Now, several well-meaning SLPs or related professionals comment that this has worked for all my clients. This has worked for all my autistic clients. I've never had an autistic client who's not a GLP. But we also want to consider who's not commenting, who is not on social media at all. I think I've seen some rhetoric about people being like, why doesn't everybody know about this? And you have to think about not everybody's chronically online. I know I'm chronically online and I don't like it. I really want to untangle from that. But I know about all this because I'm chronically online. I'm always on Instagram. I used to be on in a big Facebook group a lot. And so I was getting a lot of this information like every day. And there's that attentional bias. But who's not on social media who might have really interesting, valuable information about what's working and what's not? Who's not all up in the comments all the time sharing their opinions and ideas? I also want to get information from that too to help make my decisions. And then I also think about who's reading all of this and who's not engaging and commenting. And that might be because they're nervous, because they feel like they're not doing it right. They're afraid to disagree. And from what I've witnessed, it can get really contentious in the comments or on posts when people don't fully agree with each other. And so, who's holding back from sharing their ideas and their information related to people who are not moving through that selection process of survivorship bias because they're scared or they feel like their voice goes against that bandwagon effect? Okay, so that's survivorship bias. And then this is one that also comes up a lot. Because when we think about working with Gestalt language processors or speech language pathologists in general, there really is, and if you work in pediatrics, you've probably experienced this and you might have opinions about this. This comes up a lot when it comes to SLP versus ABA, which is a form of black and white thinking, in my opinion. But what is implicit bias? Implicit bias is our tendency to attribute positive or negative characteristics to another group of individuals without regard to individual differences or context or the amount of contact we've even had with individuals within that group, rather than saying ABA is bad. How much contact have you had with a range of individual practitioners to see how they actually work? That's just the main example I use because it's so salient in online communities. So, this attribution of certain qualities or implicit ideas about another group of people, it can be totally false, it can be semi-factual, or it could just be an overgeneralization of a perceived trait to everyone. This often is talked about most when it comes to race, ethnicity, religion, but I think it's also applicable when we think about our clinical work. But why does implicit bias come up? So humans, we turn to implicit biases because we love categorizing things. When we categorize things into defined categories, this is a heuristic, it's a mental shortcut. And being able to categorize things and people, it helps us more quickly comprehend our jobs, see where we fit in. And also, we're coming back to threats. If we can use a heuristic about someone else, whether, especially when it comes to their role on a team or their field, we can determine if there's any threat level or competition between our field and theirs. Now, the problem is that other professionals, our clients, and their families, and certain approaches, they're not a monolith. Every single person we encounter in our clinical work and every approach we're talking about is so complex and needs to be so individualized. And it's a person in front of us with a lifetime of lived experiences and their own unique take on the way that they enact their role, just like you have it. You take bits and pieces of all the things that you've learned, use it in an individualized way, and you also bring in your own therapeutic, use and sense of self. And you may not fit into that monolith of all SLPs are blank. Now, if we're using a really broad brush and implicit bias to try to understand or make a judgment about or categorize someone else from a different field, or to paint a broad brush about a certain technique, NLA is this, GLPs are this, we're going to miss important information. We may actually be holding back a client from the right intervention, and we might be creating or perpetuating interprofessional conflict. I have never had a benefit from acting upon implicit bias about an OT I work with, or a music therapist I work with, or an ABA therapist I've worked with. And this is my own personal experience and anecdote. It has only ever held me back from feeling safe and comfortable and working well with someone else on that child's team. They're on that team. I can't change that. And my implicit biases are very likely and historically have only created more problems and held me back from focusing my cognitive resources on the important thing, which is that child. So here's some examples in the field. So a clinician might say, I started with a new school that has an ABA program. I immediately feel resentment and protectiveness over our shared clientele. Because in my opinion, they're all Gestalt language processors. I approach every conversation with that ABA team on the defensive because what I believe about Gestalt language processors is not, in my opinion, aligned with verbal behavior. Another example in the field where implicit bias might come in is that my client, my school client, they have a private SLP who's floor time certified. This SLP might say that due to their implicit positive feelings and biases about this group of floor time certified professionals, I assume that this SLP must be great with that child. And because they're great, we don't need to collaborate as much as I might need to do with other professionals. That's an implicit bias that floor time certified professionals I've got positive feelings about them. I think they do a great job. And so, dot, dot, dot. But do we actually know what that therapist is like in action? Now, this can pop over to examples on social media and the way that information is presented on there. Someone might say that or notice that a researcher SLP makes an Instagram post about her concerns for an NLA claim. Now, as a reader, with my implicit bias about researcher SLPs and what they're like, I immediately discredit her ideas because she is associated with a group of people that I think are in that academic ivory tower and they are disconnected from the real clinical work. So I don't even consider that claim because it comes from someone in an out group for whom I have an implicit bias against them. Now, someone else might experience following a prominent SLP related to GLP. They share a lot of GLP content. It's great content. It's really pretty. It's really succinct. It's very clear. Now, due to that person's content quality, and because as a GLP affiliated clinician, I'm in that in group with her, I feel connected. Now, because of all that, she's sharing cool information. I feel connected to her. I have this implicit assumption that because we're in that same in group, she's probably a great clinician. She's probably getting great outcomes in her clinic, right? But I've never actually seen her practice. I've only seen the information that she's sharing through social media, and I'm consuming it with that bias. She's never shared stats or quantitative information about her success. I've never even seen a video of her engaging with a child. But I've got that implicit assumption that because we have that connection of a shared part of our identity, she's probably good to go. Okay, so like I mentioned before, there are 188 cognitive biases that have been described. We talked about 4 big ones, but I just wanted to bring your attention to this visual. It's called the Cognitive Bias Codex. It's by designhacks.co. You can find it on there. And it's also from Visual Capitalist. It was designed by John Manoogian III. The concept and the categorization was by Buster Benson. They both have the coolest names I've ever heard. And if you're interested in learning more about this, I definitely recommend looking up the Cognitive Bias Codex. And I just think it's so wonderfully designed, as well as unbelievably overwhelming. So when it comes to bias, we also want to talk about the types of decision making that we engage in. And so it's this idea of dual process theory. And this is from a 2016 paper, Teaching Metacognition in Clinical Decision Making using a novel mnemonic checklist. It's an exploratory study. And so dual process theory, there are 2 types of decision making. There's type 1 and 2. The defining feature of type 1 is automaticity. We are making fast decision making, and it's independent of that higher level control. And higher level control takes effort, time, vulnerability. It's hard. Type 1 feels way better. It's those snap decisions, confirmation bias, attentional bias. The biases really come into play here because we want heuristics. We want mental shortcuts. I certainly do. I do this all day. We all do. And it's so important to recognize that this is normal. And once we can start to acknowledge it and find names for it, it's easier to start to do something about it. Now, the defining feature of type 2 decision making is what's called cognitive decoupling. Cognitive decoupling is the analytical ability for us to compare and contrast alternatives. And we have to use our imagination before we make a decision. And so we have to decouple a bit and we have to move away from those snap decisions. Can I start to compare ideas, contrast ideas, bring in things that aren't present in front of me? And that does relate to kind of that survivorship idea of I need to imagine the things that are missing from this person's argument or from my data set to make a decision. Clinical decision making, which you know it's complex because you have children and families in front of you who have so much complexity to them. Now, clinical decision making, it involves both. We use type 1 and type 2 processes when we're engaging this. And if you engage in dynamic assessment, which most of us do, even if we don't call it that, you're doing this during every single session. Now, type 1 decision making, we can get fast and accurate clinical decisions if the decision maker is experienced and is armed with the necessary knowledge, skills, and experience. And I love the phrase that they call this. It's called mindware. So if you feel like you're a really solid clinician in your area of focus, and you feel like, yeah, I've got the knowledge, skills, and experience, I'm really good at making those fast and accurate decisions, I've got good mindware for that. However, that is more effective by cognitive biases than type 2. And if we're getting biased information and then we're engaging in bias, we're making snap decisions on a couple levels, which may be impacting our ability to make really strong decisions for our clients. So here is a page about what's called debiasing strategies. Debiasing is a process that is recommended when you start to learn about biases. Start to ask yourself certain questions to help debias yourself. You're creating more distance between the stimulus and the response. You're building out that cognition in between. And that's a model that was talked about, Albert Bandura, who talked about that in between, it's not as simple as stimulus response. There's cognition in the middle that helps us really change in deep ways. So debiasing helps that in between. It's not, I read something, I believe it or don't believe it. It's I read something, I slow down, ask questions, and then I decide if I want to make a decision about this or I'm ready to do that or not. So some debiasing strategies. Number one, I identify the type of bias that may exist in someone else's claim. So I read something, perhaps a really nice Instagram post or Facebook anecdote. I want to start to figure out, is there a type of bias that's coming up in this other person's claim? Maybe it's one of the 4 that we talked about. Maybe it's one of the other 184 that you might be curious to learn more about. Now, the other side of that is, can you identify if you have any sort of bias when you perceive that information? But you might be wondering, how do I get deeper into the type of bias and figuring out what's going on in my own mind? That's where the rest of these come in. So this relates to survivorship. I consider the non-responders. So a non-responder would be like a parent, a client, a certain set of clinicians who are not providing all this information online, maybe researchers. Who is not being talked about here? So I might read something, read a claim, read a paper, read a story, or even if my colleague says something to me in passing, who is not being talked about in this conversation? Which clients are not being referenced here? Their progress or lack thereof, is that being referenced? Now, the other sort of non-responders down in this orange box, I consider the non-responders who this might not be helping and who actually might this be harming. And that might be an alarming question when it comes to language acquisition. We feel like, oh, well, how could we cause harm with these tactics? But if we're preventing progress for a child who's in a critical period of language acquisition, if we're engaging in tactics that might actually be preventing growth, we can consider that harm. Now, if we go down to the larger pink one on the left side, I want to consider if the other person has financial or reputation-driven self-interest in their claim. So I pause, I read something and say, is what they're claiming or arguing going to have potentially some financial incentive? Now, we are all doing work to be able to make a living. And so being able to also decouple that from, is this claim itself, which may not have a lot of evidence behind it yet, is that leading to a heightened financial incentive than someone who's, salaried or working in a school or contracted? Is there a reputation-driven interest in that claim as well? Are they making a strong claim or a black and white claim because it helps boost their reputation as a leader in the GLP world? Another way I like to try debiasing, and especially in myself as someone who does create content and who has had to go back and reword a lot of my content to be less confident, I slow down and I consider if the person communicating is communicating with overconfidence. Are they making a claim that they can actually support with information about the brain, with information about sensory processing, with clear information about what's happening in the temporal lobe? And then I also want to consider if I'm interpreting or communicating with overconfidence. So, am I interpreting this information with overconfidence about my understanding about, the language processing networks? Is my understanding of syntax strong enough to be able to interpret this the way I need to? Or do I need to learn more about the foundations to then interpret this argument? Okay, this pink one in the middle, I find this one to be extremely important for myself. I am a pretty emotional person, I wear my heart on my sleeve, and so I need to check in with myself about whether the information I'm consuming about GLP is somehow reducing my anxiety about being a clinician. Is it reducing my stress? Or is it reducing my self-doubt? I know that a lot of clinicians, especially young clinicians, and I love working with CFs and young clinicians, the imposter syndrome is rampant, feeling so much self-doubt about their efficacy. And so, what I also hear from clinicians who are learning about GLP and they're very excited about it, but they also are starting to engage with more critical thinking about, the paucity of research, or they're seeing the fights breaking out in comments and they're confused. I want them to start checking in about, is the information you're consuming helping you reduce your self-doubt? And that might be really great because then you can be more confident. But if that information doesn't have a strong foundation to it, your self-doubt, your stress, and your anxiety are going down, but you don't have strong information to bring forward in your clinical decision making. So it's helping you, at least in the short term, but long term, it might be leading to null results or even creating harm by holding back progress. Another one I've been trying to engage in more, and this one, it's the top right pink, is one that some of my clients had inspired in me. I used to be very black and white thinker, anti-ABA, like shut the gate, write down, no ABA. And then I had two clients actually within 1 month. They reached out, they really wanted to try out musical language therapy ideas. They're so excited about doing music with their child. But they said, we do work with ABA and we know you have a strong stance on that, but can we talk about the reasons that we work with ABA? And it came down to privilege, access to resources, and the fact that, you know, not a lot of babysitters are equipped to work with a child like theirs. They'd been kicked out of daycares before. And so ABA was the place where their child was accepted and welcome so that both parents could go to work. So I assess whether the information provided, whether unique conditions, privileges, and access to resources are impacting those claims or arguments. Are they coming from someone who has vastly different experience, privileges, and access to resources than the client that they're working with? It's something important to think about. Here is a great tactic that I recommend, and I've been working on it myself. It's called prospective hindsight. And this is referenced by a lot of organizational psychologists who help with debiasing in large companies. Perspective hindsight is where I imagine a future where my decisions as a clinician lead to failure. I want to think about if in the future this client does not succeed and acquire language and I fail, then I want to think about everything in between. Why might I have I led to that failure? What decisions did I make or could I make? Perspective hindsight is where that decoupling can really come to life for type 2 because you have to imagine everything in between. Another one in the pink below that is this idea of thinking about am I in a state of decision readiness? So if you're making big decisions about how to work with your client, or even if you want to engage with the ideas of GLP and NLA and think about like, do I even feel drawn to this? Do I believe in it? Like, what are these concepts and frameworks? Are you in a good state of decision readiness? Which means, are you hungry? Are you thirsty? Are you exhausted? Are you emotionally overwhelmed? Are you feeling combative or a little pugnacious today? If you're in a state where you're not regulated enough or able to access strong decision-making skills because of what's going on in your life, which happens to all of us, perhaps the decision and the interpretation of the information should wait for a time and a context where you feel that your mental and emotional state is able to engage in some of that decoupling. I know for me sometimes if I'm scrolling on Instagram at the end of the day and I come across a post that is just dripping in bias, logical fallacy, and I start to feel those emotions come up, I close the app. I'm like, not tonight. I am not in a state of decision readiness. The orange below that, I consider whether any environmental stimuli or cues, for example, a very pretty post, a visually appealing post about GLP information, are those impacting my perception of the information? Do I feel like it's more true because it's in a really nice package? And I am very susceptible to that. And then also, if the other person has financial or reputation-based self-interest in their claim, do I have financial or reputation-driven self-interest in believing this claim or using this idea about GLP? Does it make me stand out as a really strong clinician in my practice? Do I get recognized by the school district for giving a really great in-service because I'm using these ideas, even though I may not have the strongest information foundations to be able to make those claims? So these are some debiasing strategies. But I want to start to think about what it means to make a plan. If you're like me, you really love learning more about your field. You're clearly doing it right now. You like professional, even if you have to do professional development, you're here on a Tuesday night. And so something about learning is appealing to you. And what we want to do is start to make a plan about how can we consume this stuff. Even if it's just having conversations with a colleague, or if you're really there in the journals themselves. But if you're like me, you are online and you're trying to understand things through other clinicians, not waiting for it to trickle down from academia. You want to get different perspectives. So this is the plan that I use. It's a social media consumption plan. And it's got 5 columns. And underneath biases, I just want to remember, please keep in mind we discussed 4, and there are a lot more. But we're going to go through a couple case examples of how to use the consumption plan. But I'm pretty limited by using those 4. There are a lot of others that apply here. So column 1, I like to write out, and after you use this many times, write it out. You can do it in your head. But column 1, what is the claim, the assertion, or the idea that someone has communicated to me about Gestalt language processing? Then I actually check in on my feelings because getting emotionally hijacked is very important to know about yourself. You may not be a very emotional person, or when it comes to your job, which more power to you. That is something I have to work very hard on. So I'm very impressed by that. But what feelings arise when I read or am told this claim, assertion, idea? I like to write all that out. Then I want to figure out what bias is at play. Is it theirs? Is it mine? Is it both? And there might be more than one. It's often a lot. We are reinforced by lots of different elements of the language that we read or hear from others. Then I figure out at least one debiasing technique. I look at the list and I say, which of these do I want to engage in to slow down and decouple. And then based on that debiasing technique, then I want to figure out what are the resulting feelings and thoughts that come up for me. Has my emotional state changed? And have my thoughts about this claim, argument, assertion, or idea shifted? Very often when I get to that fifth column, it's kind of a call to action of what I want to do next, which is part of decision making. So let's go through a couple examples. Okay, so today on Instagram, I noticed. Okay, so the claim or the assertion was, and this is not a direct quote, this is just kind of a amalgamation of things I've seen come up often. With the right supports, language just happens. And this was something I might have seen on a post. So with the right supports, language just happens. So when I read that as a clinician, I might feel a sense of relief. Okay, yes, I really want language to happen for the GLPs, kids and their families. I really want that. What a relief that if I put the right supports in, language will just happen. It also gives me comfort. I feel a feeling of comfort as a clinician. I think I'm providing the right supports. I hope I am. And if I am, okay, so it'll just happen. I'll keep doing what I'm doing with GLPs then. But then I want to slow down and think about, are there biases at play here? And just remember, we're pulling from only 4. I realize, okay, I might be engaging in confirmation bias, that this claim aligns with my current behaviors. It aligns with my current beliefs about my work with GLPs. But it also has elements of survivorship bias because it's suggesting that language will happen for all GLPs as long as the right supports are in place. But who are we not hearing about? So then I look at my list of debiasing techniques and I choose 2 of them to slow myself down. The first one I look at is I consider the non-responders. Who's not being talked about here in the GLP subgroup? Then I start thinking about children with more complex neurological and medical profiles who I might work with. And those children, even if they present as a GLP, for whom language does not just happen, even if they have what I consider to be the right supports, something else is going on here. Then I want to engage in a little bit of perspective hindsight when it comes to this idea of it just happening. I'm imagining a future where my decisions with a client lead to failure, which none of us want. I think about one of my more complex, involved client who seems like a GLP in 12 months from now. If they happen to pick up no new gestalts or don't move into the ideas of stage 2, what does that mean about the supports or intervention I'm providing now? If I can imagine that future that feels like a failure, then I can actually start to think more critically about this approach rather than hoping for the best. Now, after I do some debiasing, then I want to check in on the resulting feelings, thoughts, and actions. After I did this debiasing, I feel a call to action to think more deeply about what the right supports actually are, not just for all my clients who are GLPs, but for each client on their own. I might feel inspired to research more about interventions for their other conditions, their other diagnoses, rather than just focusing on autism. And then whether those are also needed for optimal success, not just the ideas from NLA or related frameworks. Okay, another example we're going to go through. The claim or assertion, and I do see versions of this quite often, is that ABA therapists should not work on language with GLPs. I might see that in an Instagram story. The feeling and thought that might arise as a clinician who's reading this is righteous anger. Yeah, this is my area of expertise. They aren't trained in this, and they might mess it up. They might reinforce the wrong things. They might drill I want phrases, and those kids might get stuck. And then fear comes up. What if they're causing harm through drilled language or holding them back from generative language? I also notice they feel protective. What if they extinguish gestalts because they think they're meaningless? So all those emotions come right up to the surface from the clinician who's experiencing this. But then I want to check in on that bias. The person posting it, they might have an implicit bias that all ABA therapists don't have knowledge of language. And then I have an attentional bias because I might be following all accounts that disagree with the core tenets of ABA or might have that implicit bias across all ABA therapists. Now, I might also be, when I'm reading that statement, experiencing confirmation bias that this claim aligns with my previously held beliefs about ABA. This is confirming it to me. I feel that in-group connection with this SLP who claimed this on their story, and then everyone agreeing in the comments. And so it's confirming it, it's reinforcing my in-group status, and that might be reducing my threat response to what I disagree with. The debiasing techniques I want to choose in a moment like that, because now I know that if I get a signal like that, a threat response, I want to think more deeply about it. It's still really, really hard though. The first debiasing is I check in on whether this information reduces my anxiety, stress, insecurities, or self-doubt. Now, reading a claim like this or an argument like this, it might reduce my professional insecurities, that I'm qualified enough, that I know enough, that I'm good at language, especially for younger clinicians. Am I good enough? Now, what would it mean if I dissuade a client's family from pursuing ABA? And what if that prevented that child from something like reducing self-harm behaviors? Because if I think, oh, they're going to work on language there, you shouldn't do it. But what if an element of that, and this could go for any external referral that might help, what if another area of their life is not going to improve, or what if their conditions won't be safer because we didn't provide that recommendation? And then I also want to assess whether unique conditions, privileges, and access to resources are impacting the claims that are being made, as well as I consider the non-responders. Who might this not be helping and who might this be harming? This claim might be strong about ABA therapists should not work on language with GLPs. It might be strong with an expanded argument and more evidence, but can I actually make clinical decisions that are aligned with a client's financial reality and circumstantial reality? Recommending no language techniques in ABA to a family whose child has been kicked out of 3 daycares may not be aligned with this biased idea I have. And even if there's a ton of evidence that supports this, that I can outline to a family, if their financial reality is they need a place for their kid to be while they work full-time jobs, then we're coming into a conflict here. The resulting feelings, thoughts, and actions that that clinician might have is that although they still feel defensive and they want to proceed with caution when it comes to ABA, they've connected with a more nuance about the topic and considered factors beyond black and white thinking. The clinician might feel more willing to discuss this field with parents and then collaborate with ABA professionals about language rather than saying, you can't do that, you shouldn't do that. Can we talk about how to do it differently? And then one I would like for you to think about. So this is one I'd love for you to take with you and go through the 5 columns about. I've already got the first one filled out, which is the claim or assertion. The claim or assertion is that children are either Gestalt language processors, analytic language processors, or dual processors. So I'd love for you to think about what feelings and thoughts arise when you hear that assertion. Are there any biases that the person making that claim or posting that or talking about that might have? And do any of your biases come up when you read that? Then I'd love for you to pick 1 or 2 debiasing techniques to slow yourself down and start to engage in type 2 thinking. And then I want you to see any resulting feelings, thoughts, and actions that come up for you once you've slowed yourself down and thought about this assertion a little more deeply. So here I've shared some sources that talk more about metacognition. They talk about cognitive biases. Thinking Fast and Slow is a cool book from 2011, and different implicit and explicit attitudes. And that final one by Walden is actually all about speech language pathologists. And so I think that's an interesting one to read. And so we have come to the end of this episode. I want to thank all of you who stuck it out to the end. And now I'd love to open it up for any questions about this topic, and I will do my very best to answer them. And you can either do so by raising a hand, or presenting something in the chat. All right. If not, here's what I want to do. I'm going to zoom all the way. Oh, we got something in the chat. Ooh, okay. Joni asked, could you please tell me what an ALP is? Sure. So when it comes to the framework that talks about Gestalt language processing, as well as the framework of natural language acquisition as a way of approaching Gestalt language processors, ALP refers to analytic language processing. This is communicated about as kind of the other form of language processing when it comes to child language acquisition. So with Gestalt language processing, it's about processing streams of sound in big chunks that relate to emotional, multisensory context. For example, a common one that children in the 90s tended to pick up on was when Woody from Toy Story and Buzz Lightyear, it was that moment of to infinity and beyond, and then that big jump that he took, that big dive. Some GLPs from the 90s, anytime they would jump off of something high, they would say to infinity and beyond because it matched up with that multisensory context of someone saying something as they took that big leap. So that would be aligned with this idea of Gestalt processing of a big chunk of meaning that is emotionally driven, contextually connected. Analytic language processing is what is communicated by kind of the GLP movement as being processing the world, and especially language, through small units, so single words, and then building those single words up into phrases and sentences. So for example, dog, brown dog, brown dog, go. So it's unit, unit plus unit, unit plus unit plus unit. And so it would be differentiated from ideas around Gestalt language processing, which would be, for example, if there's a phrase that a child acquired. I'm thinking about a GLP I worked with, and their recent phrase was, "Oh no, what you doing?" when something went wrong. "Oh no, what you doing?" They heard that once in kind of a unclear situation, and then they encoded that to mean a certain thing, and then they've reproduced it in similar emotional contexts. They might then break that down into, "Oh no," and then "oh no" might exist on its own, and then "what you doing?" And then they would break it down from there again, like "you doing?" and then break it down to "doing." So it's kind of big to small, whereas analytic is small to big. And so the framework of Gestalt processing and NLA, they assert that there are like two pretty clear processing styles. There are ideas around this idea of like dual processing in the middle, which I think is a whole separate conversation. And that's kind of like they have a mix of both, but it's worth considering that everything in human development is a bell curve. Jordan said, "Are you okay?" When a GLP falls down is a really common one for kids I've worked with. Yes, because if they're hearing the word you, they're probably going to do that pronoun reversal because that's what they heard. Someone shared, can you provide the name of an article or resource that provides a well-rounded discussion of GLP? Yes, so that is a great question. I want to think on that a little bit more and collect a couple resources. That would have been a great thing for me to prepare. That provides a nice balanced discussion around it. I think as we are kind of starting on the extremes, which is how most movements and new ideas happen, is we've got the extremes first, and then people start to talk in the middle about it. But yeah, and Theo, let me think more about that, and then I can share with Speech Therapy PD some of those recommendations. I think that's a worthy thing to look into. Lindsay asked, is it a good idea to add scripts, gestalts to LAMP AAC? Oh man, okay, so good versus bad. I can't speak on that. I also can't speak about your particular clients. Let me speak through my personal experiences and speak in generals. So when it comes to the GLPs I work with who use AAC, what I have noticed, again, I'm speaking from my personal anecdotal experiences. I want to make that so clear because I'm trying to stay away from bias as well and keep you out of, bias. The clients I've worked with generally, when they have shown no interest in LAMP, and then I program a spoken or sung gestalt on there, the attention to the device increases. Their interest in babbling on it, in attending to it increases. And I've seen just a greater acceptance of the device because they then realize, like, oh, that's what this is for. It can connect me to meaning, because they might not understand that this arbitrary button with this arbitrary icon with this arbitrary set of sounds that says walk or gorilla. There's no emotional connection there. It's not a gestalt. But if my clients press a button and then they hear wheels on the bus go round and round, there might be that click of, oh, I press this button, I hear this thing I understand, and then someone sings it to me. Or I press this button, I hear this song, and then someone points to a bus toy. For them, my interpretation is that by putting something that is already meaningful, emotional, and relevant and rewarding on that device, it might help them realize what else is possible for communication on that device. But yeah, GLP AAC is a conversation I think could be another great episode, or maybe 5 episodes. There's so much to talk about there. All right, everyone. It has been so much fun to talk about this. Like I've said, there's so many other biases that I would love to chat about. If you are interested, if more questions come up for you, please feel free to reach out. You can find me at crescendo.communication on Instagram, which of course is a hotbed of conflict and bias, but also a hotbed of inspiration and community. So it's not black and white. Definitely reach out. I'd love to talk to you more about this. Thank you so much. We look forward to seeing you again in another speech therapy PD course and hopefully another episode of the Gestalt Get Together. Once again, I'm Corinne Zmoos, and I am so excited that you took some time to learn more about Gestalt Language Processing. Thanks so much for joining us on today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We want you to get credit for the hard work you've put in to further your education. We also appreciate your support. We'd love for you to write a quick review of the podcast and subscribe. If you're listening on a streaming platform, feel free to rate us. 5 stars is great, 4 stars is awesome, but we also appreciate honesty around here if it's lower. That way, your ratings and your reviews will help get our podcast to more clinicians like you, as well as parents and people from other professions who might benefit from learning about Gestalt language processing. Now, if you've indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA for you. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. And also, please don't hesitate to tell us which topics you would like us to cover in future episodes. To get in touch, drop us a line in the comments section or send us a message on social media. We'd love to hear who you want us to interview, what topics are on your mind, and where you'd like us to investigate when it comes to the world of GLP. Okay, but here's the really cool part, especially because you listened all the way to the end. For our Gestalt Get Together listeners, we actually have a special coupon code to receive $20 off any annual subscription to speechtherapypd.com. Head over there to get ASHA CEUs for listening to this podcast and all other episodes. My code is Gestalt20. You're going to put Gestalt in all caps, and that is GESTALT 20. I hope to see you at our next episode.